Hi everybody, my name is Mickey Patterson and I'm going to talk today about nursing as a career. Before that, I need to read a statement from the company about the software. Our software and Adobe Flash have developed a bug on some systems. If you're having trouble hearing this presentation, click Hide Video and then Show Video to refresh it. So hopefully if you're having any problems, you let me know, and if you can't hear it well, hide your video, turn it back on again. I'm going to talk a little bit about my career in nursing, how I got there, and what you're going to be able to do to get into nursing, or if it's something that you really want to do. If I can find the next button. So, an introduction is, who am I? Well, I'm Mickey Patterson, and I'm a mom of these two beautiful kids. I'm also an RN, which is a registered nurse. And a registered nurse is someone who has taken the appropriate schooling and sat for a state board examination and passed it with minimum qualifications. So you have a couple of things that you have to do, but after you go to school, you still have to pass an exam to become a nurse, a registered nurse. I'm also a registered nurse first assist, RNFA. A registered nurse first assist is a nurse that has some extra training and is allowed to do surgeries and be the first assist for a surgeon in the operating room, passing tools, sewing skin, doing a lot of other things. I'm also a pediatric nurse practitioner. My original goal when I went into nursing was to take care of children. I worked in pediatrics for a while and went back and got a master's degree and started to take care of children in pediatrics at University of Massachusetts Medical School. I'm also an orthopedic nurse practitioner. And an orthopedic nurse practitioner specializes in taking care of all aged people that have bone and joint problems. So I do a lot of things because I'm an orthopedic nurse practitioner that are similar to being a pediatric nurse practitioner, but very much specialized in orthopedics. And I'm also a PhD, so you could call me Dr. Patterson, but I probably won't answer. Just call me Mickey. So if you have any questions as we go, I think you have a little board that you can type a question on, and I'll try to hold the questions till the end, but you can type them beforehand and I'll get to you to the end. And then there's all that other stuff. And I'm going to tell you a lot of things that nursing has helped me do or has allowed me to do. So what can I do? Well, we got to get this over with. There is your bedpan. Yes, I can empty a bedpan. No, nursing is not all about emptying bedpans, and I think that's probably my worst aggravation in the universe, that people say that. I am part of an orthopedic team. I can empty a bedpan. I have emptied a bedpan. I've been a nurse for about 20 some odd years. I don't want to tell you how many, but a lot. And I think maybe about 10 years ago I did, and probably 20 years before that. So bedpans has not really a lot to do with nursing, but the very ability to take care of somebody at that personal level when it's needed is part of what a nurse does. So I'm not going to deny it, but I'm not going to tell you it's more than one millionth of my job. So what are my roles? And I'm going to talk a little bit about being an in-house nurse practitioner, and that means working within the hospital. Within the hospital, as a nurse practitioner for orthopedics, I worked in the operating room, the emergency room, on the pediatric floor, in the ICU, and on the floor of the orthopedic unit. I also worked as an outpatient nurse practitioner, and I'll talk a little bit about that. I did some research, and we'll talk about that. I did a lot of teaching with nurses and patients, and then I did some speaking across my state, and then eventually a lot of teaching in national conferences and things. I became a NAOH leader, and NAOH is the National Association of Orthopedic Nurses, a really fun group, and whatever specialty of nursing, I truly encourage you to join your professional group. I did a lot of safety outreach. I still do safety outreach because I believe that's really important to prevent any traumas or broken bones from coming in. So it's one way that I feel like I give back to my community. I've also been a professor of nursing and now work in consulting. And I'll tell you a little bit about all of these jobs and how nursing has got me to where I am and maybe where I'm going. So when you work in-house, that means you're in the hospital, and as a nurse practitioner, you work in multiple areas. You can work as a registered nurse. You can work in any area of the hospital that you choose. You can work in an emergency room. You can work on the floor. You can work in an operating room. You can work anywhere. But as a nurse practitioner, I would do something called rounds. And rounds was every morning you would gather with your orthopedic team, usually the surgeon and maybe residents, anybody that's on your team, and you would go from room to room of all the patients that belong to that surgeon, see how they're doing, check their labs, look at their wounds, change a dressing, write some orders, order casts, put casts on, order X-rays, or check X-rays. So those are some of the things that I would do. Very busy, changes every day, never bored. We would take care of little kids that had brittle bone disease. This is one of my patients. I would also do things that were more preventive. So as a nurse, I look at people as holistic. I want to make sure all the parts of them are being cared for or addressed. A surgeon is really focused on the surgery. So what is it that needs to be done? How does it get done? And what are the procedures and all that? The patient that is on the floor has had surgery, and my role is to make sure that they understand what's going on, make sure if they can't speak for themselves, like this guy was in a bad car wreck, and he was intubated, had a breathing tube, and he was not able to move or speak for himself. One of the problems with this, this makes a little dot, sorry. One of the problems with this is that you can get pressure on the bottom of your heels or your elbows or your shoulder blades or the back of your head. And my job is to try to prevent that with something like this boot that takes the weight off your ankle. So I try to go around and prevent problems that I know could possibly happen. The other thing I do is order X-rays, look at X-rays, and this happens to be a child that has a broken thigh bone. This is his femur, was broken here, and all this white stuff is bone that's healing this femur up. So it was broken and now it's starting to heal. In about a year and a half, you'll never even know that this person had a break there. And I also take care of the patients that are on the floor. So I will go from room to room to find out if the parents have questions, to make sure all the things that need to be getting done are done. I also would go to the intensive care unit. So if I had a patient that was a multiple trauma patient, they would be admitted to the unit. They would belong to some other physician for the care and a group of nurses, but I would go along for the orthopedic piece. So I would remind the nurses or ask the nurses if they could make sure an X-ray gets done, or help them know that we're going to have surgery in 2 days for this patient, and see if anybody else has any problems, or talk to plastics, or talk about antibiotics. So there's a lot of consultation and coordination that happens with a patient's care. I would also work on the orthopedic floor, and this is a patient that happened to break his leg in a lot of pieces, has what we call an external fixator, and he's now putting a boot on so that his Achilles tendon doesn't get tied. And what would happen if you didn't pull this foot up, because you lay in bed, your foot naturally drops, and we don't want that to happen because your tendons in the back of your ankle tighten up, and then if he gets out of bed, he'll be walking around like a ballerina. So some of the stuff I do is to prevent problems from happening. And then sometimes I get called to the emergency room, and I really have to tell you about this because this kid told me that he was with his mom. His mom was a single parent, and she had just gotten a job. He's now about 16 or 17, kind of on his own. And his mom never really wanted to leave him alone after school, but he's like, no, it's okay. And she finally got a job, and she starts her job, and she's working from 3 o'clock in the afternoon until about 9. First day at work, he calls her up and says, Mom, I got a stick in my foot. And she goes, oh, pull it out. Just pull it out. Okay, I got to go. I'm at work. Calls her back. No, Mom, you got to come home. I have a stick in my foot. And she goes, oh, my goodness, I can't. You're going to get me fired. Hangs up. He calls a third time. She's like, oh, my gosh, what is it? Oh, Mom, I have a stick in my foot. You have to come home. She hangs up the phone, and she's going to think she's getting fired from her job. She's got to go home to this whiny boy that won't let her get a job because he needs all her attention. And she gets home and sees this stick sticking through a sneaker and starts to cry. So the child actually calmed the mother down, came in, come to find out, he was riding down a hill on his dirt bike, tried to put his foot out to stop it, and this stick went through. So, needless to say, the mom was really embarrassed, but the child actually did really good calming her down. I also worked in the pediatric floor. I did a lot of pediatric orthopedics. This is the cutest little baby in the world who had a problem with their pelvis and their hips and needed to be in traction. So a lot of my job, I get to still do pediatric pieces and see kids, but I would do all ages when I worked in the hospital. Then there's now, if anybody's out there and they have a kind of queasy stomach, first of all, close your eyes for the next slide. Second of all, you might think twice about being a nurse because you got to have a little bit of toughness to see kind of some of this stuff. So this is somebody's leg in traction. This is a traction pin that goes through their tibia, their shin bone, and this is what we call a skin tent. So if this skin is tenting, and if you take a lot of science classes, you'll know that the dark, moist areas are more apt to grow bacteria. We can't allow this to stay like this. So part of my job was to do something called a pin release. Kind of an icky job, but I had to numb up this area and make a little incision here to let the skin lie flat. All right, I'm done with gross stuff. Next. Hopefully that didn't gross anybody out. But a lot of things that we do, like going into the operating room. So a patient will come in, and they can be a trauma patient that, fell from a height or was in a motorcycle or a car crash, and they break some bones. And one of the things that we do is put on these things called external fixators. And this fixator is kind of like, I don't know, an erector set. It actually screws into the bone and holds everything perfectly still. If this person has a wound on the inside of their leg, or if the bones here are way too crunched up to be able to put screws and put them back together, we can put them in this rig and they can actually heal just like this. Or it will hold them still till their skin's better and we can do an incision and take care of it with some plates and screws. The OR is a really fun place. It's a very private place. You don't really have a lot of interaction with patients because most of the time they're sleeping, but it's kind of cool to watch all these busted bones get fixed back together. And there's a lot of other things you can do as a nurse. You can do cardiac, you can do, well, I don't really like eyeballs. You can do baby delivering. You can do a lot of different things. But I'm kind of into orthopedics. And this is just one of the things when you go into the operating room. Everything's sterile, so there's certain procedures that you follow that nothing touches anything that's been out to the real world. And everything that's in the operating room within the place that you do the surgery is all sterile. And then I started to work in outpatient. And an outpatient is a clinic like where you go to see a pediatrician or something like that. So you get an appointment, you come in. In orthopedics, I was an urgent access nurse practitioner, so people that had new problems would come in because nobody else was available to see them. I would see them, get their Xrays, do their exam, find out what they needed to have done, and then take care of it. This was a baby that was in a body cast, and they wet their body cast. It had urine in it, and because it was dark and wet and moist, all their skin, they have a rash here. I don't know if you can really see it on this slide, but they had a bad rash. We had to take it off, take care of the skin, put them in traction for a little while, and put them back in a cast. And then we have those cute little babies that have dislocated hips when they're born. They're so adorables, but their moms are so crestfallen. They're so upset because they have this perfect baby and now you just told them something's wrong. So nursing is not necessarily just knowing about babies with dislocated hips. It's knowing how to help that parent now cope with a baby that has a need, a special need, and cope with like some of the grieving problems that have to do with not having the perfect baby. And then I saw patients with busted bones. This is a kid that fell off a jungle gym. I'm not really sure how good you can see this, but this is a radius. This is the bone that comes at the bottom of your thumb. Your thumb's here. And if you can see this bone, it ends here. And see how white that is? There's another bone that ends here. This broke off, and it's what we call shortened. So the kid put his arm out to stop the fall, broke his arm, and came to see me. We put him in a cast. So in the outpatient clinic, one of my other roles was to take care of special needs kids. And this is one of my favorite guys. He happens to have cerebral palsy, and he happened to be staying up nights having pain with his hips, and he needed to have X-rays done. So I would take care of these guys. One of the things that I hope you learn through all the things that I have done is that nursing can go anywhere. You can see patients in the daytime, you can take care of them at night, you can take care of them in the OR, you can take care of them anywhere. This is a guy that had a really bowed leg. His leg was kind of almost round. It was called Blounts disease. And we actually kind of cracked his bone, put this fixator on, and then had him turn these little knobs every day until his leg went straight. This is at the end of his whole process when his leg is finally straight again. And that's another kind of external fixator. You'll learn all about that stuff. The other thing that I did a lot was teaching. So I would go, this fellow has a broken pelvis, and I have plastic bones here. I have a femur and I have a pelvis, and I'm teaching him where his broken bones are and what metal is going to go in there and how they're going to fix it and what the expectations are after surgery and how long it takes to heal and things like that. That was one of my favorite parts of the job. I love teaching. And this is an operating room. It actually was a video that doesn't really play well, so it was all blurry. So I'm just going to leave it at that. We set up all these instruments and tools and goods to use for a case, and they go in a certain order. Everything is sterile. It's just really kind of a fun environment. And then I did research. So as an orthopedic nurse practitioner, I had a lot of patients that had these rigs called external fixators. And every fixator has a pin that goes into the bone somewhere to hold things still. And one of the biggest problems with pins is that the skin right at the top will get infected, kind of like a pimple. And then it can get worse. And everywhere in the whole globe, every country that uses external fixators has the same problem with their patients. So I did some research in the United States with a couple other hospitals and a bunch of other orthopedic nurses to find out what was the best way to take care of these pins. Do we wash them with soap and water? Do we put, antibiotic gauze on them? Do we put betadine? What is the best way to take care of them? Well, because I did that research, I met people from England and Switzerland that were doing similar research. So I got to meet with them, and we got online and we grouped together and we did more research. And it's kind of exciting that now that the internet is available, the whole world is pretty flat. We can talk to anybody anytime, share our ideas, share what they're doing in England that might work. Actually, the leading researcher now is from Switzerland, who has done the most research on that. And it's just kind of an exciting piece of nursing that you can do. And then there's NAOH, and I got asked to do this talk because I was a leader in NAOH, and NAOH is the National Association of Orthopedic Nurses. anytime that you get into a specialty or as a nurse, I encourage everybody to be part of their professional organization. So the American Nurses Association is the #1 association for all professional nurses, and there's a bazillion of us. I specialized in orthopedics, so because I became part of this NAOH group, I got to meet nurses from all over the country who took care of pediatric orthopedic patients or trauma patients, did what I did. And we would have a meeting every year. We still do. And you can go, and it's a 3-day at some really cool place, and you can learn everything. There's like 5 classes a day going on. It's a conference. You can network with people. And you also can learn leadership skills. So being a nurse, you can learn a lot of things in school, and you learn a little bit about leadership. But when I got into this professional organization, I started as like the secretary to the Pediatric Special Interest Group and got to know a lot of people. And because, of course, you can see how shy, quiet, and reserved I am, people might have remembered me. But I ended up doing a lot of learning about leadership and became the president of this group, I don't know, a few years back. So I was on a board for 3 or 4 years and did a lot of decisions about what the orthopedic nursing group, a national group, wants to see happen across the country. And we also had a lot of international people that we would meet up, so we would make sure we're kind of on the same basis. And it does seem pretty serious. You see how like upright and all little, suits these people are wearing. But of course, when I was president, I may have brought some fun to this. So despite work and learning and everything that you do with your professional association, you make lifelong friends, and it can be really fun. Sorry about that. All right, so safety and outreach. This is kind of my fun thing to do. Every year for I don't know how many years, I have gone into the local school systems and talked to them about bones and bone safety. And I'm not sure, this could be like the 4th grade. I'm not sure what grade this is, but that's my son when he was little. And I would go there, talk to him about bones, what happens if you break it, how long it takes to heal, and things like wear your helmets or jump into a lake or pool feet first the first time, or wear your seat belts, or any of the other things that you can do for safety. It was a blast. I've done it for year after year, and at the end of this, we would put on, and my son, it was helping me here, we would put on finger casts to all the kids in the class, and they'd go home on the bus and show their mother their broken finger that they have a cast on, and they could just pull it off at night. But it was good for them to get a cast on in a non-threatening place. So when they really got one, they already know what a cast is. They know it doesn't hurt. So their nervousness and ideas for safety might be a little higher. And this is the same thing. UMass Memorial, UMass, it used to be called UMass Medical Center. We would have these like fairs and go to different open house fair things, malls and what have you, and all the parts of pediatrics would show how you can be safe, and this is one that I happen to be putting finger casts on. Kind of fun. And then of course you could be a professor of nursing. You could go get your PhD and learn how to teach and kind of have fun with all these people that I hope whoever's listening to this become. And these are student nurses. This is actually the day of their graduation before they had their caps and gowns on. And I spent 3 years with these nurses, some in my clinical, some in my pediatric or my medical surgical class, teaching them the basics of what you need to know to be a nurse, and, having them write papers and take exams and things like that. But in the end, you see that they turn into nurses, they become your colleagues, and there's a satisfaction in teaching students and watching them learn and grow and now become what they wanted to be when they grew up, I think. So teaching is also a really good thing to do too. Kind of fun. And now what I do is something called intelligent care design. I'm a consultant, I actually go into different hospitals across the country and I help them improve care. So I will, for instance, we went to one emergency room that had wait times of 1 to 2 hours. So I don't know if any of you guys have ever been to an emergency room, but you sometimes have to wait there for a really, really long time to be seen. And sometimes it's because there are more sick patients in front of you, and sometimes it's because of the system. And we actually helped this one particular hospital go from almost 2 hours to having an LED light up clock in the emergency room and on one of the billboards on their street, and it told everybody in the world it was 20 minutes for somebody coming in the door to be seen. Or they also had a cardiac team that if you came in the door, you actually got a cardiac catheterization within 20 minutes. So we really helped them with the efficiency. My favorite part is doing the orthopedic total joint centers. So if you have somebody in your family, your grandma, whatever, that needs to get a total hip or a total knee replacement, there are better ways to do it. And we help hospitals streamline and make it so that the patient is the center of their care as opposed to somebody on a production line. And the other area that I work in a lot is in operating room efficiency. So there's a lot of players and a lot of things going on. If someone has an operation, when they're done with the operation, they go to the PACU, the post-anesthesia care unit. When that person leaves, the OR room has to be cleaned, it has to be sterilized, and the new equipment and sutures and all that other kind of stuff has to come back in before the patient comes in. So there's a lot of things that depend on that, and I go to different hospitals and I help them look at what their system looks like and help them decide and figure out how they can make improvements. Kind of a fun job. I get to go all over the place. Oh, and that's my cronies. So, what education do you need to become a nurse? Well, if you're in high school, I suggest you take the sciences, anatomy and physiology, biology, any of the ologies that you can get. If you're going to college to become a nurse, the two routes now to get to be a nurse are an associate's degree or a bachelor's degree. An associate's degree is a 2-year program. I say that lightly because in theory it's 2 years, but a high percentage of people take 4 years to finish. And a bachelor's degree program, which is a 4-year university type program. I just want to put out here right now that if you go to an associate's degree, most people think, oh, I'm going to be a nurse in 2 years, this will be good. Well, there are some big detriments to that. If you go to an associate's degree program, some hospitals are not hiring associate's degree nurses because there's now research out there that shows that the more education that your nurses have, meaning a bachelor's degree or a master's degree, the less fail to rescue. And that means that if somebody needs to be taken care of, the more people with more degrees do that faster and better. I don't know if it makes sense to you, but instead of saying they don't take good care, it's the skill set about communication, I think maybe an esteem piece. I'm not sure why, but bachelor's degree nurses is a more lucrative, meaning that you'll get better jobs and you'll be able to progress in nursing better. So if you got an associate's degree and say you wanted to be a nurse practitioner, you have to go back to school and get a bachelor's degree. If you got a bachelor's degree, you wanted to be a nurse practitioner, you just have to go to nurse practitioner school. You have to get a master's degree. If you want to be a nurse practitioner, you go to there's some schools that will take you all the way through to nurse practitioner. There's some schools now that if you have a degree in something else, some kind of science, you can transfer into a nursing program. But I recommend that you get a bachelor's. So I don't know what anybody thinks about it, but this is my, what do you think you should do if you want to be a nurse? And I say, get a bachelor's. And you'll get experience. So one of the things that happens is that no matter where you go to school, you have clinical experiences. So you are able to practice nursing without actually being there. I mean, without actually being a nurse. You do a lot of clinical kind of preparation. You have an instructor, you have nurses helping you learn. It's a very exciting time of your life. I'm not going to kid you. That whole clinical experience. I remember my first day of clinical, and I remember the patients that I took care of and how nervous I was. And then I look back, 6 months later and say, I don't even know why I was that nervous. This is a piece of cake now. So what can nursing do for you? Why would you choose nursing? Well, I know that if you took nursing courses, you would know all about health. You would know about communication. You would know about psychology, how to help people in your family. And that's the big thing. Hey, Mickey's the nurse. Hey, Mickey, I got this. What should I do? And one of the things that I help my friends and my family and whomever is to find out where the information is that's good information. Because you can go on the internet and find .com something that tells you, oh, take garlic juice 3 times a day, where I might think, hey, you might need to see a doctor because this could be contagious. And nursing can give you job security. I will tell you, I can get a job in any state of the United States, anywhere that I needed to live, that I wanted to live. I can get a job any shift that I wanted to work. And a lot of people say, oh, night shift. But till you tried it, don't knock it. I used to actually work 3 to 11 when I started in nursing, and it was a really great job. It's great pay. So nursing now has come to the forefront of great pay. There are 12-hour shifts, so you can work 3 days a week and have 4 days off. There are benefits, and the benefits, you can be a waitress and make more money that week, but maybe not next week. But you don't have health insurance and dental and long-term disability and short-term. There's a lot of benefits to being in a healthcare community, that you know who are the great docs and who are the great nurses and who are the people that you want to take care of you. The other thing nursing can do for you is help you to solve complex problems. So when you go to nursing, you learn nursing theory, which actually teaches you how to do an assessment and how to do an intervention and how to evaluate it, how to use subjective and objective data, how to be non-judgmental. So all of those pieces, looking at different perspectives, helps you in your real life. So if there's a complex problem in your real life, you will learn how to go get more information. What more information do I need? How can I do this better? And it teaches you to be a little bit objective, because a lot of us think from, Mickey's eyes, this is my viewpoint, this is what I know, I don't believe this. But when you have a complex problem, the way that you learn to solve a problem for a patient is the way that you can solve problems for yourself. And the other part about nursing that has happened for me is that you have a sense of being really important. And I will tell you, when I was in high school, one of my friends who was as smart as me decided she was going to be in computer science because, you know what, they didn't have to do nights, weekends, and holidays. And I said, yeah, well, all that's good. But you're there at the worst possible moment for that person. And what you do can save their life. It can change their life. It can comfort them in the worst, most scariest moment. It can be uplifting. There's something about taking care of people kind of when they're at the worst and watching them get to their best. But there's a piece of nursing that is so satisfying, I would say, to my soul, that you can care for people and you make a difference. And I don't know if at this point in your life you've realized about, what you're doing and what you want to be, but at some point in your life, you don't want to be something mundane and just do a job and, punch in and punch out. This is a career. This is something you learn and grow, and you might not know a lot when you first get out of school, but by 1 year, nobody can pull nothing on you. You have nursing down pat. So there's a sense of joy in helping patients. There's a sense of of actually belonging and helping a family when their little girl dies of cancer. It's the most horrible thing, and now that I'm a parent, I could never do this. But before I had children, I did pediatric oncology, and I love them. I love the kids. I love the families, and we made it through this journey together. And some parts were horrible. And I'm not going to tell you I didn't cry when half these things happen, but it makes you stronger as a human, and it connects you to the world, and you see what's important in life. And then the other piece that I think that you learn in nursing is leadership. And because I went into some leadership positions and took some risks, I went to the Boston Marathon. I work at the Heartbreak Hill tent. Didn't this past year because I was in New York at a hospital, and part of me is glad and part of me is very sad that I didn't. But there's a piece that you can go volunteer and use your nursing skills to help people. Because of NAOH, I traveled all over the United States. I've been to Seattle, San Francisco, Chicago, Tampa, Nashville, all kinds of places where we had meetings, and because I've given speeches places. I also worked with a bunch of national groups for safe patient handling, and this is this group right here. There are people from NAOH, which is the National Institute for Safety and Occupational Health. There's people from the American Nurses Association, from the Veterans Administration, and we worked on research and publication of algorithms, things that would help you take care of patients better so patients didn't get hurt and nurses didn't get hurt by using lifting devices and better training people. I also got to go to Sydney, Australia, and then Canberra. These women over here in this group are the Australian and New Zealand Orthopaedic Nurses Association, which I helped, probably 10, 15 years ago now. Went there because I worked for NAOH and helped them develop their national association, and then they invited me back to be a keynote speaker. So going to Australia, awesome. And I also went to the Royal College of Nursing because of NAOH, which was in London. I actually went again in a few years ago to Dublin, and it's an international sharing of orthopedic nursing. And then this picture here is my Nursing Students Without Borders, who have gone to Ghana probably 5 times now. These are the seniors. Every year, a group of senior nursing students, all year long, they try to get money, raise money, fundraising. And they go to Ghana for the Christmas break, for the winter break, and spend 3 weeks. Sorry about that. That's my puppy. 3 weeks in Ghana doing healthcare, and it's an incredible experience. So why did I choose nursing? Because I wanted to help people. I wanted to do something good with my life. And when I was younger, you guys don't have the same problem, but in my generation, you could be a teacher, a secretary, or a nurse. Had I been in this generation, I don't know what I would have chosen, but I don't think I would ever regret 1 minute that I chose to be a nurse. I really, really, truly enjoy it. I really like science. I like to see how things worked. I like to see how medications helped people, how exercise, how things healed, and nursing was one of those. And I didn't get grossed out very easily. I'm still pretty sure I don't like sputum and things like that. That's why I'm in orthopedics. But if you have the ability, if you have the mindset that you want to do this, you can. And I love children. So I really wanted to do something to help children, healthcare, and that kind of stuff, which is why I went into nursing. And this is why I stayed. This is one of my patients that now, I'm not even sure how old he is now, but he still says, Ayavu, Icky, Ayavu. So my name is Icky, or Mickey, but he can't say it. So how do you do this? If you want to be a nurse, what do you got to do? All right, you got to understand that these two are now ER nurses. They were my students. They were in emergency rooms for their last clinical experience, and they are now both emergency room nurses, which was their dream come true. All you need to do is make a plan. You want to be a nurse? Write it down. I'm going to be a nurse. It's not easy. You got to find something that you love to do. I love kids, so that is where I sort of started my whole trail. That's where I started to think, all right, well, I want to be a nurse, and I want to be a pediatric nurse. You got to take some chances. When I first went out into, when I graduated from school, my first job was in med-surg, and I worked on an adult floor, and I worked the 3 to 11 shift, and I was new and I was green. But the first chance I got, which was a reach for me, I took a job in the pediatric unit, and I happened to be the leader. At 6 months out of nursing school, now I'm the charge nurse. So it was a risk, but I never would regret any minute of any of the chances that I took. You got to try really hard. Nursing is not an easy, I'll call it a sport. Nursing is not an easy sport. It takes a lot of learning. It takes a lot of dedication to become a nurse. And it takes an attitude of lifelong learning, because everything changes. Medications change, technology changes, the things you can and will do as a nurse are going to change. And if you don't like change, this is going to be a hard sport for you to be in. So you got to take a little risk. You got to be able to work hard. You got to be able to learn. But mostly enjoy the journey. I have been so many places, done so many things, seen so many people, tried to help as many people as I possibly could, and truly enjoy the journey. All right, any questions? Okay, I have one. How hard is it to get into nursing school? There's a little box I have to click here. Well, it's not necessarily easy. In the school that I worked at, University of Massachusetts in Lowell, has an excellent nursing program, and every nursing program says, well, this many of our graduates pass the state boards, and this many have great jobs, etc. So they could be very picky, and they actually got what I would call cream of the crop. So if you're the top 10% of your class, you will be one of the candidates. If you have a desire to be a nurse, you can also be a nursing candidate. It's not easy. There's no way I can say, oh yeah, you know what, just goof around when you're in high school, goof around when you're in college, and you'll do it. There's not a goofing around part to get into nursing. Okay. What is the hardest part of nursing? Wow, that's a hard question. I think the hardest part of nursing for me was when I couldn't help somebody. So being frustrated either at the patient wasn't able to get medication, or I wasn't able to get something from the hospital. I think or I didn't have enough time to sit with them when I needed to, let them have a shoulder to cry on. I'm not really sure. I think the hardest part is usually related to something that you can't control. Let me just click this. I heard that nurses can't have tattoos. That's a good statement. Is that true? Well, I'll tell you. There are schools that they don't necessarily forbid you to have tattoos, but you may not be able to do a clinical rotation if that particular hospital does not let you have tattoos. And if you have facial piercings and whatnot, they all need to be removed before you go into the operating room or clinical areas or things like that. How were you able to be a part of different roles, become a researcher? Okay, I did my research while I was a nurse practitioner. So when you get into, actually, I do research with floor nurses. You can get into research because you have a question. So if there's a problem and you're like, well, why do we use this thermometer? Or why do we use this medication? Or why do patients react this way? There's a lot of parts of research you can get into. I actually, when I got my PhD, I could actually claim to be a researcher. I participated in research, and you learn it in your master's program. You learn a little bit in your bachelor's program, but you learn how to be the leader researcher when you're in a master's program. So when you get to be a nurse practitioner in that type of a role, there's so much autonomy that you can actually do research. I mean, a lot of times wherever you get hired, it can even be an expectation. So if you work for a university, they may have an expectation that you get a day off to go do research. So that can be part of it. I hope that answered your question. Any more questions? All right. Well, I hope if you want to be nurses when you grow up, you do. And don't ever grow up, because I'm not going to. And I wish you all luck, and go take care of people. Thanks.